My name is Darin Preis, and I'm the Executive Director of Central Missouri Community Action. Welcome to the 2009 Eastern Region Train Their Trainers event of I Can Help My Child Stay Healthy. I'm really excited that you're here today. I wish I were there with you, but you're here to do great work. We know that social determinants of health are one of the most important indicators of quality of life and health over the course of a person's life. We also know that the more income you have, the less likely you are to suffer from hypertension, from stroke, from coronary artery disease, on and on and on. I could go through a whole litany of diseases that you're less likely to have when you make more money. The fact is that the families that we're serving through Head Start are suffering from those issues, and we know that their income makes them more susceptible to the strains and stress of poor health quality. We're here to try to change that. We know that poverty is a host of issues that are all interconnected. We're trying through this health literacy initiative to break down some of the interconnectedness. We don't want somebody to lose their job because they're missing out on, because they're unhealthy and they have to miss a day of work. We don't want someone to lose their job because they're staying home with a child who is sick. We don't want somebody to lose income because they go to the emergency room for a common ailment rather than being able to treat it at home or go to a family physician. So we're trying to break down some of those things that cause someone to either fall into poverty or to stay in poverty. Even as Congress and our country is debating the healthcare system and how it helps us to stay healthy or not stay healthy and who's paying who and all of the intricacies of that, the fact is there's a lot more to gain in our country by helping people to take care of themselves and to prevent common ailments, minimize risk of disease and of injuries. And so we really want to take a look at that part of our country's healthcare system and really what we can do as individuals, as organizations, as mentors and colleagues for those families that we're working with through the Head Start I Can Help My Child Stay Healthy program. I want to thank a few people for really heading this up. I have to start by thanking Dr. Ariella Herman from the UCLA Healthcare Institute. She's an amazing person who has done a phenomenal job putting together this initiative, and she and her team have come together to really give you the opportunity to learn about this process, to increase your capacity to do this work. I think you're going to be really impressed with what you hear. I hope that you take every opportunity to pick their brains, catch them on breaks, sit next to them at lunchtime, whatever you can to make sure that you get what you need out of this training. It's a great opportunity, and we really want you to be successful when you take all of this back to your community. I also have to thank Dr. Murnell King, who is our Early Childhood Programs Director. I should call her doctor sometimes because she's such an expert in all early childhood issues. She's such a leader at our organization at Central Missouri Community Action, and she too has put together an amazing team to use the I Can program here locally in mid-Missouri, and we're seeing some great outcomes from her leadership. Also, of course, I have to thank Tricia Wright. She's our I Can administrative assistant. She's the one that is making this all happen. She's the one making sure that you got where you needed to be today, and she keeps everything together. Be sure to give her a pat on the back. Hopefully she's in the room right now waving, because she's a phenomenal person, and we so appreciate her support. With that, I'm going to go ahead and turn it over to the trainers. I wish you all the best. This is such an important initiative. It's such an important program for the families that you serve and for the whole entire health community and the well-being of the communities that you serve. I wish you all the best. I hope that you take a lot out of this training and go back and get rid of these health disparities. Good luck.